Hello everyone, how are you today? I am Dr. Paramjeet. You're watching Dr. Education, Fitness and Nutrition. Today we are going to talk about arginine, L-arginine. What is it? Why do you need it? And why is it beneficial to some people? But is it actually needed or beneficial in bodybuilding or in rather other kind of diseases, many kind of diseases? So what is the role of it and how much is safe? What are the side effects? Everything will be covered in this video. Stay tuned. So arginine is a conditionally essential amino acid and it has crucial roles in nutrition and metabolism. It is required for the synthesis of protein and creatine, and its metabolism results in the production of an important nitric oxide. Most healthy people do not actually need supplementation with arginine because it is a component of all the protein containing foods, and it can be synthesized in the body from two important amino acids, glutamine and citrulline. Glutamine being the most abundantly present amino acid in your food and in your body. But preterm infants are unable to synthesize or create arginine internally. Preterm, therefore arginine becomes nutritionally essential for them, and it is also essential in physiological stress situations, like if you are recovering from burns or an injury or a sepsis, or if you have a small intestine or a kidney disorder, or where these are the major sources of arginine biosynthesis, kidney and small intestine. And if they have a problem, they have been damaged, then it becomes essential for you to take arginine. Now there are many sources of arginine. Animal sources of arginine include meat, dairy products and egg, all the meat, chicken, fish, whatever. Plant sources include seeds of all types, flax seeds, beans, nuts, grains, all of this, right? And it can also be made in the laboratory and it can be used as a medicine, right? Arginine plays an important role in your cell division, in wound healing, in removing ammonia from the body, and in your immune function. And the release of hormones also is affected by arginine. L-arginine is converted in the body into a chemical nitric oxide, and nitric oxide causes your blood vessels to open wider for improved blood flow, making it important in the regulation of blood pressure. L-arginine also stimulates the release of growth hormone, insulin and other substances in your body. Let's talk about growth hormone. See, intravenous administration of arginine is used in growth hormone stimulation test, because IV injection actually stimulates the secretion of growth hormone. But in a review of medical trials, it was concluded that oral ingestion of arginine, if you take it orally, it also increases growth hormone, but it can decrease the growth hormone secretion inside your body, right, which is associated with exercise. So when you exercise, your growth hormone increases, but if you are taking arginine, growth hormone increases because of arginine, and the increase because of exercise is less. So this is a little contradicting then, but this is not as much as the increase in growth hormone by arginine is not as much as which is going to happen by itself during exercise. So it is not needed to increase growth hormone. High blood pressure. See, there was a meta-analysis that seen that L-arginine reduces blood pressure with at least 5 mm of Hg for systolic and 3 mm of Hg, around 3 mm for diastolic. Supplementation with L-arginine reduces diastolic blood pressure and lengthens pregnancy for women with gestational hypertension. Women who have hypertension during pregnancy, arginine is beneficial, right? Women who have preeclampsia with high blood pressure, there also it reduces the systolic blood pressure and improves the child weight at birth. The when you actually take arginine, right, orally, like for example, if you take 10 grams of arginine, the peak concentration after 10 gram oral ingestion was around 50 micrograms per ml after 1 hour of administration, and the renal excretion, elimination of arginine from your body was actually not observed after oral administration at this dose. So the absolute bioavailability of oral 10 gram dose is approximately around 20%, right, if you calculate through that. Now arginine is effective for many things and possibly effective for many kind of situations, like for example angina, chest pain. L-arginine seems to decrease the symptoms and improve exercise tolerance and even quality of life in people with angina. However, L-arginine does not help widen the blood vessels that are narrowed in angina. So it just improves, because it actually stimulates the vasodilatation, but it will not widen the blood pressure which are narrowed, but what are actually not narrowed because of angina, they will get widened. So a little increase in capacity will happen. Then it is beneficial in erectile dysfunction. Taking 5 grams of L-arginine by mouth daily seems to improve your sexual function in men with ED. Taking lower doses might not be effective. 5 grams is needed. However, there are some early evidence that taking L-arginine with maritime pine bark extract and other ingredients might improve effectiveness for low dose L-arginine, also might be effective when used with other kind of ingredients, right? In high blood pressure, we've already seen that arginine works, and it is also beneficial in people with diabetes because it actually increases their exercise capacity. Leg pain, people who have leg pain associated with poor blood flow like peripheral artery disease, research has seen that L-arginine taken by mouth or IV for up to 8 weeks actually increase the blood flow in people with this kind of a problem. However, a long-term use does not improve walking speed or distance in people who have a peripheral artery disease. So that is one case. But if you have a surgery and you're improving from an illness, L-arginine with ribonucleic acid like EPA, like omega-3 before surgery and afterwards seems to be very helpful in recovery and reduces the number of infection and improves the wound healing after surgery. So it is good for wound healing, infections, recovery. It's good for blood pressure, but the most, and even in pregnancy it's very good during pregnancy. But the claims which you might have heard of arginine supplementation and its ability to elevate nitric oxide levels and increasing the muscle blood flow, improving exercise performance, that claims are usually directed not to normal individuals but to athletes and physically active people who are going to the gym, and all these outcomes, right, should be beneficial for enhancing your performance and maximizing your training adaptation. But unfortunately, all the research which has been done on this topic, scientific evidence does not support this claim. Arginine supplementation in healthy individual does not work. Now why is that? Understand, oral arginine supplement is most often marketed for its elevated nitric oxide level, and yes, it does increase nitric oxide levels, but like obviously nitric oxide helps widening the blood vessels, which makes important for increased blood flow, important during exercising condition. But more importantly, during exercise, nitric oxide levels are naturally increased without any supplementation, so that more blood flows through the arteries and arterioles for the purpose of delivering more oxygen and fuels to the working skeletal muscles, right? And the research has shown, a majority of scientific literature supports has shown that the increased nitric oxide production due to the levels due to nitric oxide due to arginine is not greater than what would have increased just by exercise alone. Now that is big important thing, right? In healthy individuals, if a healthy individual exercises and another healthy individual exercises with arginine, the increase in nitric oxide levels are same, right? Obviously, in contrast with healthy individual, people who are already having a cardiovascular disease or diabetes can actually benefit from the increased nitric oxide production resulting from oral arginine supplementation, because disease people who already have such kind of diseases do not actually increase their naturally increasing nitric oxide level, right? Then increasing blood flow because of nitric oxide obviously helps the claims that arginine increases endurance performance also. But research also shows that in healthy individual in population, it was reported that the time to exhaustion, the local muscular endurance, the intermittent aerobic exercise performance, all these were not improved by the result of any additional supplementation of oral arginine as compared to just routine good exercise. So, is there any side effect of taking arginine? Yes. Most people, L-arginine is possibly safe when taken from the mouth or administered as a shot or applied on the skin or used as a toothpaste, inhaler, short term. For short term, it's safe, but it can cause some side effects like abdominal pain, bloating, diarrhea or gout, some blood abnormalities, allergies, airway inflammation, sometimes worsening of asthma, and even low blood pressure can happen. See, in most of the research and scientific literature, arginine was given in a dose of 6 grams, right? And oral supplementation of up to 13 grams is very well tolerated. But if it is more than, right, if 13 to 30 grams are taken, then the side effects of abdominal, all these nausea or abdominal cramps, diarrhea will occur in a more profound amount, right? So what is the dose recommended? If you have chest pain, then 2 to 6 grams 3 times a day is recommended for up to 1 month. For erectile dysfunction, 5 grams per day is recommended, and for blood pressure, 4 to 24 grams per day for 2 to 24 weeks. For nitrate tolerance, 700 milligrams 4 times a day. For leg pain with peripheral artery disease, 6 to 26 grams up to 8 weeks. And for preventing high blood pressure during pregnancy, preeclampsia, 3 grams per day for 7 days until the delivery is given. Then we can see IV recommendations are only for leg pain people. Leg pain, 16 grams IV for 8 weeks. Now, very important, do you need to take arginine for muscle building and bodybuilding? No. Why? Because due to its inability to increase nitric oxide production or enhance muscle blood flow or to improve endurance exercise performance when compared to just a high normal intensity exercise, oral arginine supplementation is not useful and is not recommended for a healthy athlete, healthy individual. I hope this video is useful, and if you have any questions, then write down on the comment section. We'll be talking about this arginine once again and what are the side effects. Yes, it has a lot of potential interactions with many diseases, many medication, many natural things, which actually needs a different video. That's why that will be covered later. So make sure to subscribe and hit the bell icon. Make sure to let me know in the comment section what kind of a topic you need me to cover next, and I'll surely do that as soon as possible. This is Health and Fitness from Doctor Education. Stay connected, stay healthy.